In 2007, a group called the Annapolis Coalition, which are folks that think a lot about these things, came up with what they called 7 strategic goals for the mental health workforce. And since you can't read them, I will read them briefly for you. Okay? Significantly expand the roles of individuals in recovery and their families when appropriate to participate in, direct, and accept responsibility for their own care. What does that mean? In the second, we'll discuss it in a second. Expand the role and capacity of communities to effectively identify their needs and promote behavioral health and wellness. How long does the average mental health patient spend in treatment? What is the modal number of sessions for a patient coming to a private practitioner seeking assistance for depression? 1. Okay? It's higher than the modal number of publications by graduate students in psychology. What's the modal number of publications for graduate students in psychology? 0. Be different, be different, be different. Okay? Okay? We're not reaching all of these people. We have put all of our eggs in the treatment basket. And that makes sense. We've got to learn how to provide effective treatments. But it doesn't make sense when you realize people aren't coming to get what we've so finely crafted for them. And the amount of time any patient with behavioral health or a mental disorder spends in treatment is such a short period in comparison to their lifespan. It's almost inconsequential. How do we leverage the wisdom of the community to assist that patient in the recovery process? And that's one of the things that we as a profession are studying more and more, is not just short-term treatment outcome, but what happens when we involve the community in the recovery process, and what that trajectory looks like over time, and how we can influence that rather than individual patient and therapist variables in treatment. Fascinating area of investigation, something we really need to pay a lot of attention to. Strengthening the workforce. That's a big issue. We have a lot of psychologists out there. 90,000 plus licensed psychologists in the U.S. I would say to you that I don't think that that's enough. I think it's plenty if we focus on private practice models of treating selectively, identified group of patients who can afford to pay fee-for-service. I think we've got plenty of psychologists who can do that. Tell me, though, how many psychologists it's going to need for you to go onto the Navajo Indian Reservation in Arizona, to use but one example, and help people with behavioral problems that are killing huge percentages of their population via substance abuse, domestic violence, and similar issues. How many psychologists is that going to take? And do we have enough to do that? And I would suggest that we don't. Okay? We're not training enough folks in the right way. We've got to be able to train people who can provide these services, again, in and applied in those settings where patients seek the services. And then the other thing we absolutely have to do is teach psychologists, such as yourselves, to be more involved in the public policy process. That's the only way that we are going to make these changes. When we have people there, they understand the contributions and the value of psychological science. When they're not, we get ignored. So a national research and evaluation agenda on behavioral health workforce development, that's a great idea, but it can't happen without us.